Hi, I'm Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for ear infection in children. Tip number 1 is how to identify an ear infection. Ear infection are the number one reason for sick visits to doctors in children. Almost all children will have one ear infection before they turn age 1 and a second ear infection before they turn age 3. Most of the time, children have ear pain when they have an ear infection, but there are 1 in 5 children who actually do not have ear pain. There are a lot of other symptoms that go along with ear infections in children, and these include fever, being irritable, having a headache, being apathetic or just not interested as much in their environment, anorexia or just not eating as much, vomiting, and diarrhea. So there's a lot of unspecific symptoms that go along with ear infection, so you have to be on the lookout for it. One thing you should always do when you suspect an ear infection in your child is check their temperature. This will be very important information when you visit your doctor. Tip number 2 is pain relief. If you suspect your child of having an ear infection, the best options for pain relief are ibuprofen or acetaminophen. Ibuprofen can be slightly more effective, but it should be avoided in children under 6 months of age. Tip number 3, see a doctor. It's important to see a doctor if you suspect your child might have an ear infection, especially when they have a fever, which is a temperature greater than 100.4 Fahrenheit, or 38 degrees Celsius. So your doctor will determine when she sees your child, how likely it is that your child has an ear infection and how severe the symptoms are. So in order to be certain that a child has an ear infection, there have to be 3 things present. One is acute onset of symptoms, which is a sudden onset of ear pain or fever. The second thing is inflammation in the middle ear. This can either be documented by seeing a red tympanic membrane. The tympanic membrane is the eardrum, or having a child with ear pain or fever. And then the third thing is middle ear effusion or fluid behind the ear. This can be appreciated either because the tympanic membrane is bulging, it's not mobile when air is blown on it, there's an air fluid level, or there's ear discharge. So again, to be certain of an ear infection, your doctor will see 3 things: acute onset of symptoms, ear inflammation, and ear fluid or fluid behind the ear. Severity is determined by the degree of temperature and the degree of pain. Severe symptoms are considered moderate or severe pain or a temperature that's 102 or 39 degrees Celsius or higher. Tip number 4, antibiotics. If your child is less than 6 months of age, they should get antibiotics. Even if your doctor is uncertain of the diagnosis and the symptoms are only mild, antibiotics are still recommended by the American Academy of Pediatrics. If your child is between 6 months and 2 years of age, generally antibiotics are recommended if the diagnosis is certain. If the diagnosis is not certain, antibiotics are still recommended if the symptoms are severe. If your child is age 2 or older, then antibiotics are only recommended if the diagnosis is certain and the symptoms are severe. In all cases, if antibiotics are not given to your child, then it's important to have a way of contacting your doctor or of getting antibiotics in another way if the symptoms of your child's ear infection do not get better after 2 to 3 days. Some doctors will give you a prescription for antibiotics and tell you to fill it only if the symptoms have not gotten better in 2 to 3 days. In any case, there should be a plan in place for you to be able to contact your doctor or fill a prescription for antibiotics if the symptoms do not improve in 2 to 3 days. Tip number 5 is follow-up. If your doctor has diagnosed your child with ear infection, it's important that she be able to see your child 2 to 3 months after the infection to make sure that there isn't still fluid behind the ear. If fluid remains behind the ear, this is called a middle ear effusion, it can lead to hearing problems, which eventually will lead to learning difficulties. So I've covered in tips 1 through 5, identifying an ear infection, giving pain relief, seeing a doctor, giving antibiotics, when to give antibiotics, and when to follow up. In tips number 6, 7, 8, and 9, I'll go over how to prevent an ear infection. So tip number 6 is breastfeeding. If you breastfeed your child for the first 3 months of their life, it's been proven to prevent ear infections or incredibly reduce the risk of ear infections for a whole year, for their whole first year of life. So breastfeeding, tip number 6, is definitely recommended, not only to prevent ear infections, but for many other reasons, including preventing other infections, increasing your child's IQ, helping you bond with your child, helping you return to your the weight before you had your child, and preventing your child from being admitted to the hospital. Tip number 7 is avoiding smoke exposure. So it's important that no one in your house smokes where your child lives. And even better, no one should even smoke outside the house, because the clothes that they wear and their hair will have smoke in them. And smoke exposure increases the risk of ear infection. Tip number 8 is pacifier use. So it's important, pacifier use has been proven to actually lower the risk of sudden infant death syndrome in infants under 6 months. But at age 6 months, it's recommended that pacifier use be stopped, because pacifier use does increase the risk of ear infections after age 6 months. Tip number 9 are vaccines. It's important to get all the vaccines recommended by your doctor, especially the influenza and pneumococcal vaccine for preventing ear infections. It's been shown that with these 2 vaccines given at the appropriate times, there's a decreased chance of your child getting an ear infection. So I've covered in tips 1 through 5, identifying an ear infection, pain relief, when to see a doctor, when you'll most likely be getting antibiotics, and when to follow up. In tips number 6 through 9, we covered ways to prevent ear infections. And tip number 10 is believe in yourself. Ear infections are an incredibly common cause of illness in children, and these are effective ways to prevent and treat ear infections. Thank you very much for listening, and have a great day.